Hi guys, welcome to our YouTube channel, and today we will discuss about consumptions of healthcare services in United States, the impact of health insurance. First of all, we will see the abstract about the health insurance of US. Over the past few decades, the healthcare expenditures in the United States have increased due to a variety of different factors depending on their insurance plans. Americans have varying levels of health insurance coverage and may need to make co-payment or pay fully for specific health services. According to multiple studies, health insurance does appear to increase the utilization of healthcare services, except emergency services. The demographic factors such as age, citizenship, and race, ethnicity, as well as the type of health service demanded, all appear to influence the consumption of healthcare in the United States. However, many existing studies conducting in this area are not experimental or randomized, which may result in lack of validity of the estimated relationship between insurance and healthcare utilization due to confounding variables. A new experimental study similar to the RAND HIE study is needed to provide insight into the current relationship between insurance and healthcare utilization, taking into consideration changes in legislation. So now we will see the introduction. How does health insurance impact the consumption of health care in United States? Contrary to popular perceptions, the relationship between health insurance and the utilization of healthcare services is not simple to explain. An increase or expansion of health insurance coverage in the population does not necessarily mean that utilization of healthcare services also increase in all situations. Healthcare services are usually categorized in hospital, emergency, outpatient, specialist, and preventative care. There is evidence that the relationship between the utilization of care and insurance varies between the different categories of healthcare services. For example, the use of mental health services may differ from emergency department use, even at similar levels of insurance coverage. Moreover, the demographic factors such as age, citizenship status, and the race impact the consumptions of healthcare service. Health insurance has become a hot topic of debate in US for many reasons, including rising healthcare costs, varied access to care, comparison made between universal health care models in Europe and the system implemented in the US, as well as changes in legislation passed by policymakers over the years to expand insurance. Healthcare expenditures in the US are among the highest in the world. A possible driver of these increased expenditure is the presence of insurance in healthcare markets. Therefore, the relationship between the insurance and the utilization of services is of interest. The purpose of this paper is to study the aforementioned relationship as well as additional factors Additional factors that influence a patient's decisions when it comes to consumption of healthcare in the United States. This fits in well both with the general literature. The Chapter 5 of Evaluating Challenges and the Opportunities for Healthcare Reform, and as well as the literature of the journal. The Journal of Risk and the Financial Management scope is based in finance and economics. Previous GRFM articles address healthcare, economics, and related topics, and this paper fits into the GRFM because it discusses healthcare expenditure costs depend for the utilization of the health related services, and why are rising healthcare costs relevant? So for this question, the answer: 2005 study found that the medical debt has grown due to high out-of-pocket costs, accounting for nearly half of personal bankruptcies. While the impact of medical debt is striking, it illustrates the role of socio-economic status in influencing consumer behavior in healthcare market. Additionally, there is evidence that the income and the wealth of Americans influences the type of insurance they obtain. For instance, whether an individual has private insurance appears to be highly correlated with economic resources, such as having a higher income and wealth. A key finding of RAND HIE is that the patients utilize less healthcare service when out-of-pocket costs are higher. The economic incentives in terms of insurance are important and the utilization of the health services. However, the RAND HIE excluded elderly patients, and the experimental design was constrained by its given budget. The Freeman et al. 2008 systematic review found a relationship between having more comprehensive insurance coverage and increased use of physician services. Yet, the several studies within the review were unable to establish a consistent relationship between the cost sharing and the hospital or the emergency service utilization. Shows that the utilizations of the care among patients undergoing gastrointestinal endoscopic procedures responds to tired out-of-pocket prices, but not to the consumption of the services in light of specific demographic factors not addressed by the above studies. This paper focused on the demand side analysis, especially on healthcare services utilization, by looking into not only how the insurance coverage has an effect, but also how the demographic factors play the role.